Welcome back to the deep dive. Ready to unpack another stack of sources with us?
Absolutely. Got some fascinating material today.
We really do. Today we're digging into bovine babesiosis. Now, you might know it as Texas cattle fever or redwater fever, maybe tick fever,
That's right. Lots of names for it.
whatever you call it. It packs a surprisingly massive punch. So our mission today is to cut through all the info out there and really figure out why this tick-borne disease caused by these, well, microscopic parasites.
Tiny little things.
Exactly. Why it's not just a headache for farmers, but actually a huge global economic issue and honestly a masterclass in how animal health, the environment, and even global trade are all linked.
It really is a perfect example of that interconnectedness. And just to give a quick overview, babesiosis, it's this tick-borne protozoal disease caused by single-celled organisms ticks transmit.
Okay.
And the signs are pretty striking. You get fever, really severe hemolytic anemia, that means red blood cells are being destroyed, jaundice, and the big one, hemoglobinuria. That's the red water. The urine turns red or kind of coffee-colored.
Wow.
And the economic hit. It's
Right.
massive. Historically, just in the U.S., losses were over, what, $3 billion in today's money?
3 billion. Just
And-
from this.
Yeah. And right now, globally, tick-borne diseases in livestock cost economies billions every single year. So yeah, it's much bigger than just a few sick cows. It's a serious financial drain.
That economic side is staggering. Okay, so let's unpack this. You mentioned microscopic parasites. Who exactly are these tiny unseen culprits causing all this trouble?
Right. So the main players we're usually talking about are Babesia bovis, Babesia bigemina, and Babesia divergens.
Okay.
Now, among those, B. bovis, that one's generally seen as the most pathogenic, the most dangerous.
Why is that?
Well, it often leads to more severe symptoms, including neurological problems, and that's because these specific parasites can actually sequester, sort of hide out in the brain capillaries.
In the brain. Wow.
Yeah, it affects blood flow and oxygen, leading to those neurological signs. There are other Babesia species that are less severe, but those three are the ones causing the biggest headaches.
Got it. So a specific who's who of these invaders and then how they spread. You said ticks. It sounds like that's the really critical part here. Is it all about the ticks?
It really, really is. Ticks are the crucial biological vectors. For B. bovis and B. bigemina, the main ones are Procephalus microplus and Rhipicephalus annulatus. They used to be called Buphalus species. You might see that name too.
Right.
And for Babesia divergens, it's a different tick, Ixodes ricinus. Now, something important about these ticks is their life cycle. Some are one-host ticks, meaning they spend their whole feeding life cycle, larva, nymph, adult, on just one cow. That actually makes control a bit easier. You know, if you treat the cow, you target the ticks.
Okay, that makes sense.
But others, like Ixodes reginus, they're three-host ticks. So after each feeding stage, they drop off the animal, molt on the ground, and then have to find a new host.
So they can spread it around more easily.
Exactly. It really complicates control efforts because they can pick up the parasite from one animal and transmit it to several others throughout their life.
Okay, that's a key difference.
And here's maybe the most critical part of the transmission, something called transovarial transmission.
Transovarial? What's that?
It means the Babesia parasites pass directly from an infected female tick into her eggs.
No way. So the baby ticks are born infected.
Precisely. New generations of ticks hatch already carrying the parasite. This makes the ticks themselves long-term reservoirs. The infection keeps going across tick generations even without immediately finding an infected cow. It's a very effective survival strategy for the parasite.
That's quite insidious. Makes getting rid of it much harder, I imagine.
Definitely. And while ticks are the main route, it's worth mentioning a couple of other ways it can spread, though less common.
Okay.
There's mechanical transmission, think contaminated needles, surgical tools, castration equipment, even biting flies carrying infected blood between animals.
Right. Basic hygiene becomes critical then.
Absolutely. And also, though it's pretty infrequent, it can spread transplacentally from an infected mother cow to her unborn calf.
So considering all these transmission routes, especially the ticks and this transovarial thing, what does that mean for herd health overall and for trying to control it?
Well, it leads to a really big challenge, which is the carrier state.
Carrier state.
Yeah. So cattle that get infected, survive the acute illness, they often become asymptomatic carriers for life.
For their whole lives. But they look healthy.
Exactly. They look perfectly fine, no symptoms, but they've still got low levels of Babesia parasites circulating in the blood.
Ah, so they're silent spreaders.
Precisely. They act as a continuous hidden source of infection for any susceptible cattle nearby, and, crucially, for the ticks that feed on them. Ticks pick it up from these carriers, and the cycle continues. This makes control and especially eradication incredibly difficult because you can't just look at a herd and see who's infected.
That hidden aspect sounds like a nightmare for farmers.
It absolutely is. Now, if we look at what the disease actually does inside the cow.
Yeah, let's get into the pathology.
So when the Babesia gets injected by the tick, it invades the red blood cells, and it multiplies inside them, eventually causing the cells to rupture, burst open.
Okay, that's the hemolysis you mentioned.
That's the hemolysis, and that rupture leads directly to the main signs. Anemia, obviously, from losing red blood cells. Jaundice, because of the breakdown products of hemoglobin. And then the most dramatic sign, hemoglobinuria.
The red water.
The red water. The hemoglobin spills out of the burst cells into the bloodstream, gets filtered by the kidneys, and ends up in the urine, turning it that characteristic red or dark brown coffee color.
Grim picture.
It is. And in really severe cases, this massive cell destruction can also trigger a big inflammatory response throughout the body, and even something called DIC, disseminated intravascular coagulation, which is a serious clotting disorder.
So that red water, it's not just a weird symptom, it's literally a visual alarm bell flashing danger. I bet that's a sight that stops a farmer or a vet cold.
Absolutely. It's unmistakable and signals something serious is wrong. If you're a producer or a vet, what are those key signs that scream babesiosis?
Yeah, what are the telltales?
In the really sudden acute cases, peracute or acute babesiosis, you'll see that sudden high fever, maybe up to 106 Fahrenheit. That's 41 Celsius.
Wow, really high.
Oh, yeah, plus the anemia, the jaundice, and that very obvious hemoglobinuria, the dark urine. You'll also see rapid heart rate, rapid breathing, tachycardia, tachypnea. The animal will be lethargic, just wiped out.
And you mentioned neurological signs with B. bovis.
Right. With B. bovis, because it can affect the brain, you might see signs of oxygen deprivation, like weird behavior, aggression, maybe staggering, lack of coordination. And sadly, without treatment, death can happen fast in these severe cases, sometimes within 24 to 48 hours.
That's incredibly fast.
It can be. Now, there's also a chronic form. Chronic babesiosis is much more subtle. You might just see persistent mild anemia, maybe some weight loss, poor appetite, reduced growth in young animals, or lower milk production. And these animals often become those carriers we talked about.
The silent spreaders again.
Exactly. And one more really crucial point here is the age-dependent severity. This is key for management.
Also,
Calves, say under 9 months old, they usually get infected without showing severe signs. They might have a mild fever, but that's it. And this early exposure actually gives them really good, strong, long-lasting immunity. It's like a natural vaccination.
interesting. So getting it young is actually protective.
In endemic areas, yes, it often is. But the flip side is, older animals, especially over a year old, if they haven't been exposed before and then encountered the parasite, they are much more susceptible to the severe acute form of the disease. That's where you see the high mortality rates.
So introducing older, naive animals into an infected area is really risky.
Extremely risky. And just connecting the dots further, the high fever in pregnant cows often leads to abortion. And bulls can experience temporary infertility, so more economic hits.
This definitely raises a big question then.
Yeah.
If some signs can be subtle or maybe look like other diseases, how do you actually pin down babesiosis accurately in a herd?
Yeah, that's a critical diagnostic challenge. Differential diagnosis is key. You absolutely have to distinguish it from other things, especially anaplasmosis.
Another tick disease, right? Also causes anemia.
Exactly. Anaplasmosis is also tick-borne, also causes anemia and fever. But here's the crucial difference, and it's a huge clue in the field. Hemoglobinuria, that red water. It's present in babesiosis, but it's notably absent in anaplasmosis.
So the urine color is a major differentiator.
It's a massive presumptive indicator out on the farm. The mechanism of red cell destruction is different in anaplasmosis, so you don't get the hemoglobin spilling into the urine. Seeing red water strongly points towards babesiosis.
Okay, that's a vital field sign. But for confirmation,
Yeah.
you need labs.
For a definitive diagnosis, yes, you rely on the lab. The classic method is looking at blood smears under a microscope. You stain them with Gemsa stain,
Okay.
and you can actually see the Babesia organisms. They look like little pear shapes, often in pairs inside the red blood cells. We call them pyroplasms.
You can actually see them.
Yep. And you can even sometimes tell the species apart by how they look. B. bovis are smaller, often central in the cell. B. bigeminar are larger, and the pairs are often at a sharp angle to each other. It takes a trained eye, but it's very informative.
Cool. What about other tests, especially for those carriers?
Right, for finding carriers or for checking immunity in a whole herd, blood smears aren't great because the parasite numbers can be really low, so we use serology looking for antibodies in the blood. Tests like IFA, the indirect fluorescent antibody test, or ELISAs are the way to go.
ELISAs are pretty common now, right?
Very common. Competitive ELISAs, in particular, are widely used. They detect antibodies that show the animal has been exposed, and these antibodies stick around long after the clinical signs are gone, which is perfect for identifying carriers.
Makes sense. Any other high-tech options?
Absolutely. Molecular diagnosis using PCR polymerase chain reaction. This detects the parasite's actual DNA. It's incredibly sensitive, much more so than looking at smears, especially for finding those low-level carrier infections. It's reported to be like 1,000 times more sensitive for B. bovis than a thin blood smear. Plus, PCR can easily differentiate between the Babesiosis species.
Wow, okay, so a range of tools from field science to DNA testing.
Exactly. You need them all, really, depending on the situation.
All right, we've definitely got a handle on the who, the how, and the what it looks like. Now, the fight back. What are the strategies? If an animal is sick, what can be done?
Okay, treatment. The main approach is using antiprotozoal drugs. One of the most effective is immunocarb dipropion.
Hemocarb.
Yeah, it works well against both B. bovis and B. bigemina. And it has this interesting potential to actually clear the parasites completely from the animal, achieve what we call sterile immunity. Plus, it gives protection for several weeks, maybe 3 to 6 weeks.
That sounds great. Like, really effective.
It is effective, but, and this is a huge but,
Oh.
it's a suspected carcinogen. It has very long withholding periods, meaning you can't sell milk or meat from treated animals for a long time. And crucially, it's not approved for use in food-producing animals in the USA or in Europe.
Wait, really? So this highly effective drug is banned in major regions?
Exactly. That regulatory difference is a massive factor in why controlling babesiosis is such a challenge globally. Different countries have different rules, different tools available. It complicates everything.
That's a critical piece of the puzzle right there. So what else is used?
Another drug used very widely in many parts of the world is diminazine acetate. It acts fast, knocks the parasites down quickly. It can also offer some short-term protection, maybe 2 weeks for the European types, up to 4 weeks for the African types.
Okay, so there are options, but with complications.
Definitely. And beyond the drugs, supportive care is vital, especially if the animal is really sick.
Like what kind of care?
Things like blood transfusions if the anemia is severe. Fluid therapy to combat dehydration and shock. Using NSAID's non-steroidal anti-inflammatory drugs to bring down that high fever and reduce inflammation.
Makes sense. Treat the symptoms too.
Right. And maybe most importantly, minimizing stress. These animals are incredibly fragile when they're acutely ill. Rough handling, forcing them to move too much, that can actually be fatal. They need gentle care.
Good point. Okay, so that's treatment, but obviously prevention is better than cure. What about stopping it before it even starts? What are the prevention strategies?
Yeah, prevention is key, and it's got several layers. Tick control is fundamental.
Makes sense. Attack the vector.
Exactly. This often means using acaricides, chemical dips, sprays, pour-ons regularly to kill ticks on the cattle.
But I feel like I hear a lot about resistance to those chemicals.
You absolutely do. Acaricide resistance is a huge growing problem worldwide. Ticks evolve, they become resistant to the chemicals we rely on. It means we can't just keep pouring on the same stuff.
So what's the alternative?
We need integrated pest management, combining chemical use strategically with other methods, like pasture management, keeping grass short, rotating pastures, maybe fencing off wooded areas where ticks thrive. Reducing the tick habitat helps.
Okay, managing the environment too. What else?
Vaccination. There are live attenuated vaccines available in some countries, particularly endemic areas like Australia and parts of South America and Africa.
Live attenuated.
Yeah.
Meaning weakened live parasites.
Correct. They generally give good, long-lasting immunity. But again, there are challenges. Safety concerns, sometimes the attenuation isn't perfect. The vaccine strain could potentially cause disease. There's also the risk of accidentally transmitting other blood-borne pathogens if the vaccine production isn't perfectly sterile.
Ah. So not a simple solution either.
Not simple. And that's why they aren't widely available or used everywhere, especially not in places like the US or Europe, which aim to be free of the disease. The risks are often seen as outweighing the benefits in non-endemic areas.
Got it. Any other prevention angles?
Yes, definitely. Breed selection is a big one. Some cattle breeds, particularly Bos indicus types like Brahman cattle, are naturally much more resistant to ticks and tick-borne diseases than European breeds, Bos taurus.
So using tougher breeds helps.
Or crossbreeding to introduce some of that resistance into European breed herds. It's a very effective long-term strategy. And finally, good old biosecurity and herd management.
Like quarantining new animals.
Exactly. Quarantining and testing new animals before they join the main herd is crucial to avoid introducing the disease. And meticulous hygiene with equipment.
You mentioned needles earlier.
Needles, dehorners, castration tools, ear taggers, anything that breaks the skin and can transfer blood. These need to be thoroughly cleaned and disinfected between every single animal if possible, or at the very least, you need to change needles frequently. The recommendation is often at least every 10 animals, ideally more often. That mechanical spread is easily preventable with good practice.
Seems like a lot of management needed on many fronts.
It really does take a multi-pronged approach. There's no single silver bullet.
So, we've covered the science, the spread, the sick animals, the treatments, the prevention. But let's circle back to that economic impact you mentioned at the start. What does this really mean for the bottom line, for farmers, for the industry globally?
It means billions of dollars lost every year, globally. Like I said, the historical U.S. cost was over $3 billion adjusted. Think about Mexico. A 2013 estimate put their annual loss just from cattle ticks, which carry Babesia and other diseases, at over $500 million US.
$500 million a year in one country from ticks.
Yeah. And the losses aren't just dead animals, although mortality in naive adults can be up to 90%, which is devastating.
90%.
In a susceptible, older herd encountering it for the first time, yes. But beyond deaths, think about the survivors. They have reduced weight gain, lower milk production, they don't convert feed as efficiently, their immune systems might be compromised, making them susceptible to other things.
Right.
Plus, you have the direct costs of treatment, the extra labor, and we mentioned the reproductive losses of abortions in cows, temporary infertility in bulls. It all stacks up to this enormous economic burden on the cattle industry, especially in tropical and subtropical regions where these ticks thrive.
What a deep dive this has truly been.
Yeah.
We've gone from these tiny protozoas and their incredibly persistent tick partners through the really complex symptoms, the clever diagnostics, and all the way to these multifaceted battle plans for controlling babesiosis. It's just crystal clear how profound the economic and health impacts are right across the globe.
Absolutely. And the challenges, they really are ongoing. You've got the rising tide of acaricide resistance, which is deeply concerning. You have the regulatory hurdles that limit the use of effective treatments and vaccines in really key agricultural regions. And you still have that persistent problem of the asymptomatic carrier animals quietly keeping the whole cycle going.
Yeah, those hidden carriers seem like a constant issue.
They really are. It all just underscores how critical it is to keep pushing research for new tools, better vaccines, maybe novel control methods. And importantly, we need sustainable, holistic approaches. It has to be collaborative vets, farmers, researchers, policymakers, all working together to get a better handle on this global threat.
It really highlights that interconnectedness we started with. So here's a final thought for you, our listener. Given how babesiosis shows this incredibly complex dance between tiny organisms, the environment, animal health, global trade, even drug regulations, what other overlooked silent spreaders or maybe hidden costs might be impacting other parts of our world? And how can we use this kind of deep dive thinking to maybe uncover them?
That's a great question to ponder.
Definitely something to think about. Thank you so much for joining us on this deep dive. Stay curious and keep exploring.